Hi students, today we are going to see the ulnar nerve video. It can be asked as short notes or the essay. I will tell you what are the side headings, and already in my median nerve video I have told you the side headings. What are the side headings we are supposed to make? If a nerve is asked, the side headings are commencement and the course and the branches and the clinical application. So commencement, everybody knows the ulnar nerve commences from which part of the brachial plexus? It's from the medial part of the brachial plexus. And first side heading. Second side heading is a course in the sense where and all it goes. So number 1 goes in the axilla, number 2 goes in the arm, third is in the forearm, and fourth is in the palm. Okay, so we'll see one by one. Axilla. So the axilla, what happens? You can see nicely the nerve. Okay, median cutaneous nerve of forearm is here. Just below that only you will be having the ulnar nerve. This is very important relation. Median cutaneous nerve of forearm, below that you have the ulnar nerve. This is the first relation in the axilla. Number 2, first which card in the axilla, what is the relation? Number 3, what happens in the arm? Arm, it lies below and it lies just goes towards, it pierces the medial intermuscular septum, because we cannot see the ulnar nerve in the anterior compartment. It goes back. So now we can see arises from the medial cord of brachial plexus, C8 and T1, enters the arm, lies below the medial cutaneous nerve from that we have seen at the level of the insertion of the coracobrachialis. It pierces the intermuscular septum. So here is area, here is your coracobrachialis. Here it goes back, because can you see this? It goes back and pierces the intermuscular septum and reaches a posterior compartment. It will not go along with the radial nerve. It just where it goes to the posterior compartment. It reaches the medial just behind the medial epicondyle, because ulnar nerve can be palpated in the inflammation of the nerve in the leprosy patients, otherwise called as Hansen's disease. In that, behind the medial epicondyle only we can feel the ulnar nerve. So it goes back. Don't ever write the ulnar nerve in the front of the arm. Then in the arm, it doesn't give any branches. Then it goes, can you see? It goes to the forearm. Forearm, how it goes? It pierces or it passes between the heads of the flexor carpi ulnaris and enters into the forearm. And forearm, you can see nicely, flexor carpi ulnaris you can see here, and this is flexor digitorum profundus. It lies on the profundus and overlapped by the flexor carpi ulnaris. It just lies like this, and then see, crosses the medial ligament of the elbow joint, passes between the two heads of the flexor carpi ulnaris, enters the forearm, passing along the medial border. That and all we have seen. Now last, it gives the branches, articular branches. As usually when it crosses the elbow joint, it gives the articular branches. I have already told you in the median nerve video, you have to write the articular branches for all the nerves. So muscular branches, everybody knows, it supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, and then communicating branch occasionally joined with the median nerve, and then dorsal branch supplies the dorsum of the hand. This dorsal branch goes to the dorsum and it supplies the rest of the areas where the radial nerve is not supplying. Okay, those areas it has to go and supply, and then that is very important, the dorsal branch. Okay, and then palmar cutaneous branch. Palmar cutaneous branch of ulnar nerve, already we have shown here. See ulnar nerve, see this is the flexor retinaculum. In the flexor retinaculum, you have to see one thing, when the ulnar nerve is coming here, you can see here ulnar nerve enters here in the palm. Before entering this area, it already gives one branch dorsally, and then see it pierces a canal here, then comes out. Okay, what is the canal name? Guyon's canal. Guyon's canal, the relation will be asked as an MCQ. Ulnar artery is laterally placed. Laterally only you have the thumb, right? So it's laterally placed, and the ulnar nerve is medially placed. Okay, understand, this is the relation in the Guyon's canal. Guyon's canal is nothing, a flexor retinaculum, it splits and forms a canal like thing. That's why it is called as Guyon's canal. And then see the nicely the superficial branch and a deep branch. The superficial branch goes and supplies the subcutaneous muscle present in the palm called palmaris brevis. This is very important. So palmaris brevis is subcutaneous. It means it is attached to the skin. So it is supplied by the superficial branch. None other muscles are getting its supply from the superficial branch. Only the palmaris brevis it gets the supply from the superficial branch. Very important MCQ. And then the deep branch goes deep and it goes to the basis of the metacarpals, betacarpals, and deep palmar arch. It goes beneath. And then what happens after that? Okay, what happens? Okay, passes above the flexor retinaculum along with the ulnar artery, Guyon's canal, that all we have seen. Superficial deep branches I have told you. Now what are the cutaneous branches? It goes to the palm. This is a palmar aspect, right? Palmar aspect, it goes to divides into two branches. Number one, it supplies the medial aspect, one branch. Another branch, it splits into two and supplies the adjacent sides of the index, little finger and the ring finger. So totally 1.5. And then like dorsum also, dorsal branch I have already told you, no? The dorsal branch goes and supplies like the same 1.5. Okay, and then superficial branch already I have told you, adjacent sides. And the important thing is it pierces opponent's digiti minimi. If you want you can write that, otherwise leave. Just digital branches where it supplies you can write. And then what are all the branches? 14 branches it is supply. The deep branch of ulnar nerve supplies 14 branches. What are the branches? Okay, see here you can see the hypothenar muscles. How many hypothenar? 3 hypothenar muscles. And then these two lumbricals, 3 and 4 lumbricals, totally 5. And then palmar interosseous 4, dorsal interosseous 4. So totally 8. 8 plus 2, 10, 10 plus 3, 13, and the one muscle which is lying deep, it is called adductor pollicis. So totally 14 muscles are supplied by the deep branch of ulnar nerve. Along with that you can write the joints, intercarpal joints, carpometacarpal, metacarpophalangeal joints, all the joints, nearby joints you can write. And then nerve injury, if hypothenar muscles are paralyzed, what will happen? Definitely the muscles will be atrophied. In median nerve palsy, thenar muscles will be atrophied. Here hypothenar will be atrophied, and lumbricals and interosseous will be atrophied. So lumbricals action and interosseous action is palmar interosseous PAD, PAD, P for palmar interosseous, A for AD for adduction, D for dorsal interosseous abduction, DAB, dorsal interosseous abduction. So what will happen? Both adduction will be lost, abduction will be lost. And how come the claw hand? This is called claw. Claw is like crab, okay, claw hand. So claw hand, how it occurs? Action of lumbricals is flexion of the metacarpophalangeal joint and extension of the interphalangeal joint. So if it is injured, what will happen? Flexion of the metacarpophalangeal joint, ulta, so extension of the metacarpophalangeal joint and flexion of the interphalangeal joint. So this type of finger is called as claw hand. And interosseous is out, so inability to adduct and abduct. Adductor pollicis, the deep muscle is out, so adduct the thumb. So what are the tests you want to see? 1.5 fingers out and tropical ulcer, because sensation is lost. So you will be getting the ulcer because it's and nail deformity will be there. Test, what is the test you are going to do? Paper test and book test. Paper test is ask the patient to hold a paper like this between your index finger. Ask the patient to hold a paper like this between the index, the little finger and the ring finger. So the patient will not able to hold, because what happens? Because your interosseous is out. So which interosseous? Adduction is not possible, means palmar interosseous adduction. So adduction is not possible. So he will not be able to hold. If you take out the paper, remove the paper, so easily they can remove. They will not be able to hold. And the next one is called as book test. Book test is ask the patient to hold a book between your thumb and the index finger. So ask the patient to hold like this. He will not be able to hold because adductor pollicis is out. So he will not be able to hold. So these are the two tests we are supposed to do. That's all about the nerve, ulnar nerve. Thank you.